Hello, 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 YouTube world. It's Miss Patty with For Your CNA with our live CNA question and answer game show. And today's edition is really exciting. This is the March into Spring edition. So we're going to focus on mobility questions. So we'll give everybody a few minutes to come in. So when you come in, just give me a hi in the chat. That way I know you're here. And we will get started in just a few minutes. So come on in, have a seat, limber up those fingers, and we'll get started in just a minute. Hi, Danao. Thank you for joining. So good morning, all. Good morning. We do this live question and answer game show the first and third Tuesday of every month, and I feature 15 questions that are similar to what you would find on the state exam. And you have an opportunity to answer those questions right here on YouTube in the chat and win prizes. So first place is the CNA card game. I think it's here, yep. CNA card game. This is a lot of fun. It's a rummy style game. And this goes free to the first place winner. And then we also have badge holders that we'll give away as well. This is a 4-year CNA badge holder. The only place you can get these is by winning them on the game show. Third place is going to be a motivational keychain and bracelet to let you know just how important you are to the healthcare world. So when you come in, give me a hello in the chat and we'll get started in just a few seconds. Go ahead and let me know that you're here. Limber up those fingers. And if you like this anytime during the stream, please feel free to give me a thumbs up. That way YouTube knows that this is something that you found valuable. So good morning, Giovanni. Good morning, Fatal. And Haroner. Hi, Carissa. Good morning. Hello, Jordian. Hello. Thank you guys for joining. Hi, Carly. Hi, PS Gameplay. Very good. Good morning. All right. Well, looks like we've got almost 20 people on. So without further ado, let's get into today's topic. So today we're going to be featuring mobility questions. So this can range anywhere from mobility as in walking a patient or doing range of motion, a different type of adaptive equipment or aids that we can use. It can also cover some questions related to immobility or risk factors for bedbound patients. So we have a lot of varied questions within this topic, and that's one of the reasons I wanted to bring this out as a separate topic all on its own. So Nathan, good morning. You're welcome, Jodian. We love doing this. Sal Love, good morning. Good morning, Megan. Carly, where are you, please? Carly, I am in Spring Hill, Florida. It's a little town north of Tampa, right on the west coast of Florida. So if you look north of Tampa, right on the coast of Florida, that's where Spring Hill is. And actually, I'm just a tiny bit north of Spring Hill. My business is in Spring Hill, but I'm actually a tiny bit north in a little place called Weeki Wachee, and we're best known for our mermaids. So that's where I am. It's awfully hot here today. For March, it's really hot. All right. So good morning, Alucci. Okay. So the way this works, we're going to focus on mobility questions today. The way this works is that each question will be displayed for 60 seconds. You're going to type into the chat 1, 2, 3, and 4, depending on the answer that you want to choose, 1, 2, 3, or 4, and you're going to hit the send button. Remember, you have to hit the send button. Now, this is important, guys, and I need you to understand this. Because this kind of came up last time, when you hit the send button, you're going to see your answer, and your answer, because it's local, you typed it in, your answer will actually show up on your screen before the other answers do. That doesn't mean that it was submitted earlier than the other answers. So it's really important that you understand we have a program that reads the comments as they come into YouTube. Because you are all commenting at the same exact time, YouTube will decide which comment gets displayed first. And of course, we do have points for the fastest, extra points for the first right answer, the fastest right answer. So please remember that YouTube is the one that determines the order that those comments are received. So please remember that. And we're going to get started here. So you've got about, from the time I read the questions, you'll have about 30 seconds to answer. You can answer right away, though. Let's see here. Where can I write you? Let's see. Hold on one second. Let me pull this up. I'm sorry, guys. I forgot to do this. Okay. So this is my email address for those of you who want to write. Okay. How close am I to Zephyr Hills? We're about 45 minutes from Zephyr Hills. All right. Here we go. Are you guys ready? Are you ready? Okay, we're going to get started in 60 seconds. So go ahead and limber up those fingers. 60 seconds. All right. So the question is going to be displayed. You will type into the chat 1, 2, 3, or 4. Remember, your first answer is the only one that is graded. First answer is the only one that the system accepts. So type in 1, 2, 3, or 4, hit send, and then my computer or my program will read your answers and award points. And then at the end of the game, when everything is done, all 15 questions are done, then we will announce the top 3 winners. And I'll give you instructions on what to do then. We've got 10 seconds before we get started. Ready? Ready? Here we go. Question number 1. Where is the gait belt applied? 1, around the CNA's waist. 2, around the patient's waist. 3, under the patient's clothing. Or 4, around the patient's chest. So, good morning, Blue. Thank you for joining. All right, so where is the gait belt applied? We're starting off with an easy one this time. 1, around the CNA's waist. 2, around the patient's waist. 3, under the patient's clothing. Or 4, around the patient's chest. Remember that the system will only read your first answer, so you can't change your mind after. It's only going to read your first answer and award points if that one is right. So we've got about 5 seconds left. Yeah, I know, Blue. It's easy to get them confused. Absolutely, around the patient's waist is correct. That is where a gait belt is applied. Now, a lot of people will put a gait belt around their waist as a place to hold it. But when we're working with patients and using a gait belt with patients, then that gait belt needs to be around their waist, not ours. And I actually saw this when we were at testing center. Quite a few people would put the gait belt around their waist as the CNA and have the patient hold on to it as they were standing, and that's not the right technique. Gait belt goes around your waist. Or I'm sorry, the patient's waist, not yours. Megan came in first on that one, followed by Carissa, Alucci, and Guerline. Good job, guys. Good job. All right, we're going to move on to question number 2. You are assigned to perform flexion extension exercises. You know that this is an 1, optional task. 2, side-to-side motion. 3, up-down motion. Or 4, inappropriate task for a CNA. So type in the answer that you want to choose. You are assigned to perform flexion extension exercises. You know that this is an 1, optional task. 2, side-to-side motion. 3, up and down motion. or 4, inappropriate task for a CNA. So type in your answers. What do you think a flexion extension exercise is? Go ahead and type in your answers. You've got about 5 seconds left. And the correct answer is an up-down motion. Yeah, most of you guys got that one right. Very good. Flexion extension is an up-down motion, kind of like this. So this is flexion. This is when I bend the body part, it's flexion. When I extend the body part, it's extension. So flexion, extension. They are two halves of the same exercise. One moves it away, one moves it back. So, let's see here. Blue says, I had to take the food handler's card test today. One of the questions was how to properly defrost meat. One of the answers I could choose from was to frost the fish on the trunk of my car. Oh my goodness. Carissa came in first on that one, followed by PS Gameplay and Megan and Inside. Good job, guys. Good job. I'm sorry, Jodian. This is number 3. A bedbound patient will need to be repositioned 1, every 15 minutes, 2, every 2 hours around the clock, 3, every 4 hours while awake, or 4, only when the patient requests. So a bedbound patient will need to be repositioned 1, every 15 minutes, 2, every 2 hours around the clock, 3, every 4 hours while awake, or 4, only when the patient requests. So go ahead and type in your final answer. Final answer. You've got about 10 seconds left. Jodian, if you go, okay, Jodian, don't put number in there, just type in the actual number. Don't put any words, just the actual number so that it will pick it up. All right, yes, bedbound patients need to be repositioned every 2 hours around the clock. That means we're waking them up at 2 a.m., at 4 a.m., at 6 a.m. We're waking them up and changing their position. But if we don't, they risk developing bed sores, and that's a really, really, really big deal. So don't do your patient any favors by letting them sleep through the night, thinking that you're helping them. You're actually not. Because inability to move yourself can bring about a whole host of problems. So every 2 hours around the clock, we need to change their position. So Megan came in first on that one, followed by Guerline, Danao, Blue, and Alucci. Good job. Very good. Okay. All right, moving on. Here we go. Question number 4. You are assisting a patient walk with a cane. Which hand would the cane go in? 1, the patient's right hand. 2, the hand opposite the weak side. 3, the hand on the weaker side. Or 4, either hand. So you're helping a patient walk with a cane. Where does the cane need to go? Which hand needs to hold the cane? 1, the patient's right hand. 2, the hand opposite the weak side. 3, the hand on the weaker side. Or 4, either hand. Yeah, this is a tougher question, guys. This one's a little bit harder, but this is similar to what you might find on the state exam. So you have about 5 seconds left. You guys are kind of all over the place. Lots of answers coming in. And the right answer is number 2. Yeah, the hand opposite the weak side. Or another way of putting it is you want the cane on the stronger side because we need a little bit more support over there to help make up for the fact that that stronger side is going to have to compensate for the weaker side. So because it has to compensate, we're going to give it a little extra boost with the cane. A little more stability, a little more strength. So that means that the cane needs to go on the patient's stronger side to be effective. So good job, guys. Very good. Let's see how we did on scores. Megan came in first on that one, followed by Danao, Inside, Heroner and Alejandra. I'm sorry if I'm saying these names wrong. I apologize. The writing is little on my screen. I'm having a hard time reading. All right, number 5. A patient has difficulty walking to the bathroom and appears unsteady. The CNA should, 1, notify the nurse. 2, use a walker for extra stability. 3, use a gait belt. Or 4, request a physical therapy consult. What do you guys think? Patient has difficulty walking to the bathroom and appears unsteady. The CNA should, 1, notify the nurse. 2, use a walker for extra stability. 3, use a gait belt. Or 4, request a physical therapy consult. Yeah, this is a tougher question, isn't it? You guys are kind of split on your answers. So think carefully about this. Patient has difficulty walking and appears unsteady. The CNA should, 1, 2, 3, or 4. Go ahead and type in your answers. Yeah, I know this is going to surprise a lot of you. The right answer here is notify the nurse, because the nurse doesn't have anything in the care plan about using any additional aids. It doesn't say anything in the question that we have permission to use a walker or a gait belt. So if we have a patient who is displaying difficulty walking and appearing unsteady, that means that's a change. CNAs cannot initiate treatment. You can't decide to use a walker. You can't decide to use a gait belt. And you can't request a physical therapy consult. The only option for us is to notify the nurse, because they've got to look at that change. So Inside came in first on that one, followed by Alucci, Blue, I Am Carl, and Guerline. Good job. Very good. Yeah, this was a little harder, wasn't it? It was a little bit harder. Okay, let's go on to question number 6. A patient with Parkinson's disease slides his feet in a shuffling manner as he walks. You would, 1, remind him to pick up his feet. 2, report this to the nurse immediately. 3, understand this is a trait of the disease. Or 4, use a wheelchair to take him to meals quickly. So a patient with Parkinson's disease slides his feet in a shuffling manner as he walks. You would, 1, remind him to pick up his feet. 2, report this to the nurse immediately. 3, understand this is a trait of his condition. Or 4, use a wheelchair to take him to meals quickly. Go ahead and type in your answers. You've got about 10 seconds left. This is a tricky question. Tricky question. I'm going to explain why in a minute. So yeah, the right answer is to understand this is a trait of the disease. This is very normal with Parkinson's disease. A shuffling gait, inability to pick up the feet, is a normal trait of Parkinson's disease. This is a tricky question because you've been trained, if report it to the nurse is one of the answers, you're probably going to pick it. But we have to be able to differentiate between things that are normal for the disease as well as things that need to be reported. So if you've been told to always pick report it to the nurse, it's not always going to work, because there's going to be questions like this as well. So Carissa came out first, followed by Hero, Brenda, Blue, and Dave's. Good job. Good job. I know that was a tricky one, wasn't it? All right, moving on to question number 7. Here we go. A diabetic patient has neuropathy and refuses to allow you to perform foot care. You would, 1, have him sign a refusal waiver. 2, document that he is non-compliant. 3, notify the nurse. Or 4, withhold meals until he allows the task. So a diabetic patient has neuropathy and refuses to allow you to perform foot care. You would, 1, have him sign a refusal waiver. 2, document that he's non-compliant. 3, notify the nurse. Or 4, withhold meals until he allows the task. Go ahead and lock in your final answers. You've got about 10 seconds left. 10 seconds. Yeah, I know. I put this one right after the last one to kind of trick you a little bit. I know. I'm mean, aren't I? All right, the right answer here is notify the nurse. Sure, absolutely. Anytime a patient refuses a skill, we have to notify the nurse. So the last question, notify the nurse, was not the right answer. This question, it is. So you've got to use a little bit of discernment on the state exam and remember what is normal for certain conditions. So this situation, the patient is refusing something. Refusals always need to be reported to the nurse. CNAs do not document that the patient is non-compliant. That is actually a diagnosis. That is a observation of a condition, and you're not allowed to document that. So inside came in first, followed by Megan, Danal, Blue, and Alucci. Good job, guys. Very good. Yeah, be very careful about documenting that a patient is non-compliant. It can actually get you in trouble. All right, number 8. Patients in bed must always be positioned, 1, in the middle of the bed, 2, flat on their back, 3, in bed with all side rails up, or 4, as close to the wall as possible. So patients in bed must always be positioned, 1, in the middle of the bed, 2, flat on their back, 3, in bed with all side rails up, and 4, as close to the wall as possible. Oh, good job, Megan. Megan has been listening to my lectures. Absolutely. Good job. Good job. So where do we want to put the patient in the bed? Do we want to put them in the middle of the bed, flat on their back, in bed with all side rails up, or as close to the wall as possible? You've got about 5 seconds left. Go ahead and lock in your final answers. The right answer is in the middle of the bed, or like Megan said, the safe zone. I talk about that in my live classroom live streams. Yeah, patients need to be in the middle of the bed, whether they're on their side or their back, does not matter. They always need to be in the middle of the bed. They don't necessarily need to be flat on their back. Some patients may have a care plan that has the head of the bed elevated, or we need to elevate the head of the bed for skills like feeding or mouth care. Side rails require a doctor's order. Remember, a side rail is a restraint, so we don't use side rails on the beds all the time because it keeps our patient immobile, which leads to a lot of problems. Carissa came in first on that one, followed by Megan, Brenda, Jodian, and Inside. Good job. Very good. All right, half over. Here we go. Question number 9. You are assigned the following tasks on a weak patient. Which would be done first? 1, range of motion exercises. 2, assist with toileting. 3, making their bed. Or 4, partial bed bath and change gown. So you're assigned to do all of the following tasks on a weak patient. Which would be done first? 1, range of motion exercises. 2, assisting with toileting. 3, making their bed. Or 4, partial bed bath and change gown. Go ahead and type in your final answer. So we're going to do all 4 of these tasks. Which one needs to be done first? 1, range of motion. 2, assist with toileting. 3, making their bed. Or 4, partial bed bath and change gown. All right, the right answer here is toileting. Toileting always is first on the list because your patients may not have the ability to hold it for very long. They don't have the same bladder control you do. The bladder control is affected by age. It's affected by disease. It's also affected by immobility as well. So we have a weak patient. They're not really moving around a whole lot because they're weak. So toileting is going to be a very, very, very important aspect of their care. Range of motion exercises, making their bed, partial bed bath, those aren't time sensitive. Toileting always is. Megan came in first on that one, followed by Nanda, Hero, Carissa, and Fatal. Good job. Moving on to question number 10. You are helping the resident walk when they suddenly become faint and start to fall. You should, 1, hurry the patient back to the chair. 2, put a gait belt around the patient. 3, ease them to the floor and call for help. Or 4, hold the resident up and keep walking. So if we're helping a resident walk, when they become faint and start to fall, what is our appropriate action here? Do we, 1, hurry them back to the chair? 2, put a gait belt around the patient? 3, ease them to the floor and call for help? Or 4, hold the resident up and keep walking? So go ahead and type in your final answer. You've got about 10 seconds left. All right, so the right answer here is, you guys got this one right. Yeah, ease them to the floor and call for help. Absolutely, absolutely. Patients that are sitting on the floor can't fall on the floor. So we can get help, people to help us get them up off the floor. That's not a problem. We can wash off whatever they came into contact with on the floor. That's not a problem. You can't wash off a broken hip. So we don't want the patient to fall. A controlled descent to help them sit on the floor actually keeps them safe until we can get some help. Never ever try to hurry somebody back to the room or their chair. If they're not tolerating a slow walk, they're definitely not going to be able to tolerate a fast rush, right? So we don't want to hold them up either. Blue came in first on that one, followed by Carissa, Alucci, Megan, and Danao. Good job. All right, let me take a break. Question number 11. You are assisting a resident with range of motion exercises when they complain of pain. What should you do? 1, push past the pain to build strength. 2, stop at the point of pain for the remaining repetitions. 3, ask the nurse to medicate the patient. Or 4, refuse to perform ROM on the patient. So you're assisting a resident with range of motion exercises when they complain of pain. What should you do? 1, push past the pain to build strength. 2, stop at the point of pain for the remaining repetitions. 3, ask the nurse to medicate the patient. Or 4, refuse to perform range of motion on the patient. Yeah, this wasn't a challenge for you guys at all. You did really good here. Absolutely. Number 2 is correct. We're going to stop at the point of pain for the remaining repetitions. So if I'm doing range of motion on the patient's elbow and we get to here and the patient says, ow, then the next repetition is only going to go to here. We're not going to go all the way to the ow, okay? So we're trying to, for range of motion as CNAs, we are trying to maintain their current level of ability. We're not trying to make them stronger, faster, better. We're not doing any of that. We are maintaining the muscle mass that they have. So it's very, very important that we understand why we are doing range of motion exercises, so we don't promote pain. So Inside came in first, followed by Nanda, Alucci, Guerline, and Brenda. Very good. All right, question number 12. Here we go. A patient has severe shaking in their hands. The CNA should, 1, perform all ADLs to prevent embarrassment. 2, tell the patient to pay attention when using their hands. 3, allow the patient to do as much as possible for themselves. Or 4, restrict the diet to finger foods and thickened liquids. So a patient has severe shaking in their hands. The CNA should perform all ADLs to prevent embarrassment. 2, tell the patient to pay attention when using their hands. 3, allow the patient to do as much for themselves as possible. Or 4, restrict the diet to finger foods and thickened liquids. So go ahead and type in your final answer. I got a lot of different answers on this one. A lot of answers. All right, the right answer here is number 3. Allow the patient to do as much as possible for themselves. So we don't want to just rush in and do all the ADLs. If you do that, you're actually making the patient more dependent, and that can lead to depression. We don't want to tell the patient to pay attention when using their hands. They're not a child. And we do not have the authority to restrict diets to finger foods and thickened liquids. That's not in our level of ability. We don't get to make decisions. We don't get to change the care plan. So what we want to do is promote independence. Even though their hands are shaking, we're going to allow them to do as much as they can for themselves. Carissa came in first on that one, followed by Megan, Nanda, I am Carl, and Danao. Yeah, that was a hard question, wasn't it? It was a hard one. Okay, moving on to question number 13. Here we go. Range of motion exercises can help prevent 1. Contractures, 2. Pressure sores, 3. Obesity, or 4. Dementia. So range of motion exercises can help prevent 1. Contractures, 2. Pressure sores, 3. Obesity, or 4. Dementia. So what do you think range of motion exercises are prescribed to help prevent? Go ahead and choose your final answer. You've got about 20 seconds left. Yeah, you guys did good on this one. Good job. All right, about 5 seconds left. And the correct answer here, of course, is contractures. Yes, absolutely. Range of motion exercises keeps those muscles and tendons in use, which helps prevent them from contracting, which is where we get that word contractures. And if we don't do that, joints like this, as the tendon starts to shorten from non-use, it'll draw the arm up. And this is how we get people in that fetal position, because all of their tendons have drawn up because we haven't been using them very much. Range of motion doesn't really help prevent pressure sores. Turning and repositioning every 2 hours and keeping the bed free from wrinkles will. All right, Brenda came in first on that one, followed by Carissa, Danao, Megan, and Inside. All right, moving on to question number 14. Almost done, guys. You're doing great. Almost done. A button hook and sock assist are tools used in what kind of nursing? 1. Palliative care. 2. Restorative and rehabilitative care. 3. Cardiac rehabilitation. Or 4. Recreational therapy. So a button hook and a sock assist are tools used in what kind of nursing? 1. Palliative care. 2. Restorative and rehabilitative. 3. Cardiac rehabilitation. Or 4. Recreational therapy. So go ahead and lock in your final answers. You've got about 10 seconds left. Final answers. The correct answer here is 2. A button hook is something that you put into a buttonhole, hook the button, and bring it back through. It's good when you don't have good fine motor skills, because buttons can be very tricky to get into the buttonhole and arrange. A sock assist kind of looks like it's a contraption that holds your sock open so your foot can just slide in. Both of these tools are to help patients remain independent while dressing. So this would be part of restorative and rehabilitative nursing. Palliative care is end-of-life care. Sasao came in first, followed by Danao, Carissa, Lauren, and Megan. Very good. All right, last question. This is it. Last one. To ensure good body mechanics when lifting heavy objects, the CNA should 1. Stand with feet shoulder width apart. 2. Keep arms completely extended far from their core. 3. Bend at the waist. Or 4. Keep your feet together at all times. So to ensure good body mechanics when lifting heavy objects, the CNA should stand with feet shoulder width apart, Keep arms completely extended far from their core. Bend at the waist, or keep your feet together at all times. Go ahead and lock in your final answer. You've got about 10 seconds. This is it for all the marbles. Last question. And the right answer is number 1. Stand with feet shoulder width apart. You need a wide base of support, especially if we're lifting things that are heavy. You also want to keep heavy objects close to the center of your body, not way out here. If I have a cup, and this is actually kind of a heavy cup, if I have a cup out here, it's going to take a whole lot more effort for me than if I hold it here. So you want to make sure that you've got a wide base of support and that you're bringing things close to the center of your body. And we want to bend at the hips and the knees, never at the waist. So Danao came in first, followed by Nanda, Megan, Carissa, and Blue. Good job. Blue, I'll answer that question in just a second. So good job on that score. So here it is, final scores. Megan came in first, followed by Carissa and Danao. Very, very good. So my 3 winners, you're going to first, second, and third place winners. You're going to send me an email to foryourcna@gmail.com. Let me know your screen name, your real name, your mailing address, and what place you came in. And we'll get your prizes out to you. So Megan, you're getting the CNA card game. And I forgot who was second. I gotta wait till it comes back around. Hold on. Second place is gonna get the badge holder. So who was second? I gotta write this down. Who was second? Second place was Carissa. Carissa's getting a badge holder. And Danao, the Phoenix, you are getting a motivational keychain and bracelet to celebrate the change that you make in the lives of others. All right, so to answer Blue's question, how is my puppy? My puppy is absolutely amazing. She just turned a year old, and she just had her own puppy. Yeah, we kind of had an accidental oops here between my 2 dogs, and it resulted in another puppy. So now I've got another puppy, and we're keeping him. His name is Jet. He's super adorable. I'll bring him on. He's only a week old, so I can't handle him too much yet. But in in 2 weeks, we'll have another game show. On the next game show, I'll bring him and show him off to you guys so you can be part of it. So we're calling this Jet City. So Jet is the new addition. He's part Beagle, part Labradoodle, and he's all cute. I love him to pieces already. So thank you so much, guys, for joining me on today's game show. We are going to I'm working on the website in the next couple of months. All of these questions that you're seeing on here, we're actually going to have on our website as well for you to be able to go back and review and get the feedback that you need to be able to learn how to answer these questions. If you struggled with any of these, you probably want to get our free ebook. So let me put my ebook in here. That free ebook will help you. Hold on, ebook. The free ebook will help you learn how to answer the written test questions and decipher what they're actually asking you with each question. So if you are getting ready to test like Carissa is, go get that ebook. It is free. You can download it, go through it very quickly, and it will help you on the state exam. Carissa, I wish you tons of luck tomorrow. Good vibes out to you. You're going to do fantastic. Come back and let us know how you do, but we'll be thinking about you. Good luck. Yes, absolutely. Thank you, Danao. I really appreciate that. I love what I do. We're trying to wrap up some pretty big projects right now so I can get back into providing some new content for you guys that I think is going to be super helpful. So we're on a path, but I need a cloning machine. If you've got a spare cloning machine laying around, let me know. All right. So until next time, guys, I'll see you in 2 weeks. 2 weeks, we will have another live game show at 11 a.m. on Tuesday. Tomorrow, we're graduating a class out. So if you haven't watched one of my graduations, you might want to tune in because I have got a fantastic resource to help you ace those interviews and make sure that you're the one that gets hired. So if you haven't tuned into a graduation, make that a priority. We'll be live tomorrow at 9 on our YouTube channel. Until next time, guys, happy caregiving. Bye.